Um, Hello, class. My name is Ugo Onijaka, and today I'm going to be talking about tuberculosis. This is my introduction. Tuberculosis is an infectious disease that affects mainly the lungs. We're going to be talking about that soon. And we're going to be talking about how it spreads largely through respiratory droplets. We're going to be talking about the pathology, where it travels to. And we're going to be also talking about how it causes infection known as mycobacterium tuberculosis. It also affects other organs such as the brain, the spine, the kidney, and the intestines. Okay, now we're going to go on to the next slide. This is the epidemiology. This is the epidemiology of the tuberculosis. From now on, I think I might be referring to TB if I mess up, so please bear with me. Tuberculosis is one of the leading causes of death in the world. According to statistics, about 1.4 million people are dying because of tuberculosis in 2019. 208,000 of these deaths were caused by people with HIV. With HIV, it weakens your immune system, making you more susceptible to catching tuberculosis. So just be aware of that, because we're going to be talking more and elaborating more on that. Currently, tuberculosis is present in all countries and affects all of age groups and sexes. For little kids, if you're under the age of 5, your immune system is still weak. So what tuberculosis does is it affects weakens your immune system even more. And if you're a young child, it could be pretty fatal. And also with older people, it also affects older people because your immune system is also starting to get weak. It affects all age groups and sexes. Tuberculosis can be cured and prevented. We got different tests. We got different vaccines, and we got treatments. I'm going to be also elaborating on that. And you're going to know more about that by the end of this recording. We got different countries, such as, according to the World Health Organization, we got Nigeria, we got Bangladesh, we got South Africa, Philippines, China, Indonesia, Pakistan, and India as the high burden with countries that contain most of the cases. There have been 87% of new cases found, and currently India is leading in these new cases. Rifampicin-resistant TB is also known as multi-drug resistant TB. Cases of multi-drug resistance were about 206,030, 10% from the 2018 data. Here I got a picture of a map. The dark blue sections are the places, the regions where TB cases are pretty high. As you can see by the chart, the lighter the color, the less cases there are. And you can see mainly from other continents and other countries, there's a lot of places. We're going to be talking about that soon too. There's characteristics of M. tuberculosis. We got gram-positive bacteria, obligate anaerobe, mesophyll, non-spore forming, slow generation time, lipid-rich cell wall containing mycolic acid, and we got acid-fast. Acid-fast bacteria mean that when you collect sputum on the patient, you will have to do an acid-fast staining procedure. And if that's indeed Mycobacterium tuberculosis, it will stain a bright red color. In addition, this bacteria is really aerobic. We're going to be talking more and emphasizing on that. We're going to be talking about transmission on the next slide right now. TB is mainly transmitted through inhalation of infected respiratory droplets. Coughing has been demonstrated to release the largest number of infected droplets. And in addition to coughing, we got yelling, we got sneezing, we got even talking. They can also play a huge role into spreading the transmission from the disease. And tuberculosis is airborne as well. And those particles, when you cough, as those are exposed throughout the air, the nose or mouth, they're putting the bacteria into the animal for where others can come along and breathe it in, which is something you wouldn't want to happen. And depending on if the patient has a strong immune system, they can develop active tuberculosis, which we are going to get into later. Ingestion of M. bovis with unpasteurized milk is also implicated in the causation of catching tuberculosis. And once the bacteria is inhaled, it is pushed into the lungs. Transplacental transfers have also been documented as rare. Right. Okay. To stop the transmission of tuberculosis, what is highly recommended is by reaching a respirator, which includes N95 mask. Wearing a surgical mask wouldn't really help it, but N95 mask is more that's recommended by the CDC to put on your face, as they are more effective in filtering those little droplets and protecting you from them. And you wouldn't want them, entering your mouth. And another way is by negative pressure room. A person who has tuberculosis will be put in a negative pressure room to prevent the spread of the bacteria. You want to keep the doors closed, and yeah, that's another way. Now on to the next slide, we're going to be talking about the risk factors of tuberculosis. Risk factors of tuberculosis includes immunosuppression, such as HIV infection, organ transplant, diabetes, cancers, silicosis. Smoking can weaken the immune system. Consumption of alcohol, overconsumption of alcohol could also. IV drugs, taking immune suppressant drugs could play a huge role into weakening your immune system, allowing for the disease to enter and affect your immune system. Large crowd gatherings could also be a risk factor. Close contact with tuberculosis patients could be a huge factor. Age also is a factor. When you're under 5 years of age, you still have a weak immune system, you know what I'm saying? So it's going to be extremely hard to fight against those. Same with an older man that stated earlier before. They each both have a weak immune system. So you got to be careful around going around children if you have tuberculosis. That's something you should be watching out for. You got health care workers who are also dealing with other patients carrying the disease. You got to be also worried of that. You got to be worried about malnutrition, undernutrition, immunosuppressive therapies, malabsorption syndromes, and I'm going to be also getting into more. Also, although it's not talked about in the slides, other risk factors include tight living quarters, such as correctional facilities where there's a lot of inmates closely living together. You also got homeless shelters where they have a lot of homeless people living together. The cost, if one person gets infected, it could be a whole mess. A lot of a lot of increase in tuberculosis. Also living the poverty level. They are also at risk, and close residences as well. If you're living close by with other people and if someone catches the disease, you are highly susceptible you're going to catch it next. Another risk factor is immigrants. As I said before earlier, I'll show you the chart with the amount of cases, countries with the highest cases. A lot of immigrants travel here and get spread the virus to different countries which are less susceptible. And due to these high cases in these countries, what they do is that when you're like a little kid, when you're still young, they're going to inject you with this vaccine. This vaccine is called the BCG vaccine, Bacillus Gamete Glorin vaccine. This vaccine prevents tuberculosis. It's important to ask if you're working in the healthcare profession and one of the patients might be an immigrant and may have taken this vaccine, if they tested to tuberculosis. What this does is, although you are immune to it, it could be really troublesome trying to find what it is, especially if you're taking a PPD test. It's going to appear as a false positive because what your immune system does is that your immune system already recognizes the virus. They already have been exposed to that mycobacterium tuberculosis. When you inject the vaccine, you get a small dosage of that bacteria, you get a small dosage of that TB, and that's how it's going to appear as a false positive because you already had the vaccine. You already had a dosage of it before. So asking signs and symptoms are really important. What we're getting into right now are going to be the signs and symptoms of tuberculosis. Before I get into the signs and symptoms, I'd like to say that there's a lot of different types of tuberculosis, and I'm going to be also covering that soon. Signs and symptoms of pulmonary tuberculosis. This includes chest pain, persistent non-productive cough, ongoing cough. You're going to be coughing bloody sputum. You're going to be having a fever, fatigue, mucopurulent sputum, and you're going to be having shortness of breath. That's something you got to check up on. You got silent syndrome of extrapulmonary tuberculosis and tuberculosis lymphadenitis. My bad for spelling. Cervical lymph involvement is the commonest abscess, and sinus is the common sign, matches lymph nodes. Pericardial and peritoneal involvement. Peritoneal involvement, you're going to get ascites, abdominal pain, chest pains, swelling, non-specific fevers. And the signs are going to be pericarditis, ascites, cardiac tamponade, and pleural effusion. For brain, you're going to have TB meningitis, headache. You're going to have a fever. You're going to have convulsion. You're going to have altered sensorium, nerve palsies, ventricular system obstruction leading to hydrocephalus, and arteries may lead to infraction. Other CNS presentation, tuberculoma and vasculitis. Once you suspect TB, you can suspect it after 3 weeks of persistent cough, fever for more than a month. You get weight loss, blood stained sputum, night sweat, and as I stated before earlier, we're above the age of 70 or below the age of 14. I stated before earlier, we have different types of TB. It can be classified according to the organism affected. It can be rare pulmonary and extrapulmonary tuberculosis. It can also be classified as active and latent tuberculosis. Something about tuberculosis that differs from most bacterial infections is that it rarely causes symptoms right away. And as it begins to make you sick, the symptoms appear gradually and are often misdiagnosed as other illnesses. So you might be mistaking it for something else. Tuberculosis is most common in millions of people, but nobody really gets sick. According to the CDC, about 30 million people in the United States have latent tuberculosis infections. This happens because when many people breathe it in, our immune system recognizes it because our immune system is pretty strong, able to handle it and take care of it on its own. And certain people, any bacteria and hold is instantly destroyed by their immune system, depending on how strong your immune system is. In others, the TB bacteria become dominant after being surrounded by macrophages, a form of white blood cell. This stage is known as latent infection, and it can last for years or even a lifetime. People with active tuberculosis, the symptoms may appear weeks after the primary infection in people with compromised immune systems. According to Times, about 30% of people who are exposed to Mycobacterium tuberculosis develop latent tuberculosis, and if untreated, 5 to 10% of those people will develop active tuberculosis disease at some stage in their life. People with HIV, as I stated earlier, they have a much higher percentage of catching that because their immune systems are really weakened, severely weakened. While a person with latent tuberculosis has no symptoms and is not really infectious, we have different type of tests. We got, medical treatments as well, and that's what I'm going to be going into the next slide with. Here we really know about the pathophysiology. We talked about the respiratory droplets with the Mycobacterium because here we had the pathophysiology. We talked about how when you inhale the droplets. Here we have the pathophysiology. We already talked about this, how the droplets with Mycobacterium is inhaled. We talked about how it's pushed through the airways to the alveoli. In the alveoli, the bacteria undergoes multiplication. It is then trapped into the bloodstream and through the lymphatic system. We talked about that. It may also be moved hematogenously into the organs such as the kidney, brain, bones, producing extrapulmonary tuberculosis. We know how the immune system also responds. We talked about how the macrophages produces white blood cells, phagocytes such as macrophages that engulf too many bacteria. We talked about that already. Lymphocyte bacilli TB then spread to the other normal tissues, accumulation of exudate in the alveoli, and bronchial pneumonia. We talked about the signs and symptoms: the weight loss, fatigue, low-grade fever, night sweats, anorexia, and tuberculosis, such as a PPD test. It can also be referred to as a Mantoux test, TB skin test for tuberculin skin test. It involves when the patient is getting injected with a purified protein derivative with tuberculin needle in the inner part of the forearm. When this happens, the person, your nurse or anybody else giving the injection, they're going to inject it into your forearm normally, and there's going to be a little bit of swelling. And that swelling is important because in that injection site, we're going to be looking about we're going to be like, we were checking for induration of the injection site as it is hard and swells up. I stated before, the results of this test are based on certain criteria of risk factors we stated earlier. If the site measures 15 millimeters, the site of the swell, it is positive for everyone. If it is 10 millimeters or more, it is positive in a person who is an immigrant, an IV drug user, a worker, or a child less than 4. If the site is 5 millimeters large, it is positive in someone with HIV. If the person has been in contact with someone else with active tuberculosis, has an organ transplant, or an immune system is suppressed due to drugs, another form of test we can also take is a blood test. All of us might know what a blood test is. We've all haven't gotten one in one point of our life before. When you draw blood, you're going to draw blood, and then in this case, they're going to put it into 3 test tubes in which they will evaluate to see the immune system's reaction to it. These tests, the name of the test is called the gamma release assay test, IGRA, and they come into 2 different types of tests. These include the QFT test or the T-spot test. But the benefits of taking this test is that the patient doesn't have to return to get the results read as they would during the injection. And they won't get a false positive test. So it's more convenient and it's more tolerable. Because I remember when I said that those who have had the BGC vaccination, how they have false positives because their immune system would have already recognized it. Yeah, well, that wouldn't have happened with a blood test. This test is becoming more and more popular than the PPD test and more favorable. The only downfall to this test is that it doesn't indicate if a patient has latent TB or active TB, meaning a chest X-ray and a sputum culture could be needed to help differentiate that. I have 2 slides over here that shows this. In this slide, you can see the X-ray of this person's chest. You can identify the interstitial infiltrates, and you can see how tuberculosis is able to be spread easily. Also have another image. I'm going to be also talking about the treatment of tuberculosis. We had different types of treatments as well. Treatments, people with latent tuberculosis have it way much easier than those with active tuberculosis, in that the recovery process is much faster and less stressful. And treatment is way faster and a shorter schedule, unless they're having complications. So when you have active tuberculosis, a patient with active tuberculosis, they're going to be treated much more strictly and daily. Will be around 4 medications as well. They're treated as an outpatient for their home, because treatments take for about 6 months to 1 year to treat. They'll be on about 4 different medications. And the reason why they're treated at home is because if you're in the hospital, it would be way more expensive, and you wouldn't want those medical bills to keep coming up. While at home, a person with active tuberculosis is isolated completely. They'll have to be in a totally different room from another person. Children cannot be around. Adults cannot be around. If you want to cough, you got to do it on a tissue, and you got to dispose of that by flushing or you gotta put it in an airtight bag and dispose of that. That's really important. You're also excluded from going to work. You can't go to any public outings. You can't. The only place you can really go to, the only place you can go to, is your medical appointment. And you can't break those rules at all. I know it's way much harsher than the coronavirus. Way much harsher than that. Pretty much a long quarantine period, which is really stressful, as everybody experienced this year. Uh, the only way they could be able to get out and be a little bit free is if they have been on their medication for at least 3 weeks and signs and symptoms are showing improvement. What the CDC recommend is a program. It's called the Direct Observed Therapy Program, or called the DOT program. It is used to ensure that people with active tuberculosis complete their full prescription schedule, a qualification, a qualified healthcare worker, or a loved one. It could be your wife, your friend. They can administer your dosage of medication. They have to monitor the patient's swallowing, and you gotta monitor the symptoms if it's getting better or not, and they gotta record that. This DOT program also helps with compliance and prevents increase in drug-resistant TB by making sure the patient does not forget to take the prescription medications. Just think of it like this: you got a elderly person, and you gotta make sure you take care of them. It can be your mom or dad. You gotta make sure they're on their drug, they're taking their proper medication, and they're taking the right amount. That's pretty much what the DOT program does. So yeah, that's really important, and it's also recommended by the CDC and really helpful. We also have different medications we take. I'm going to go into that right now, actually. Is that we take different medical treatments. To cure this, we take first line of drugs for treatment. This includes ethambutol, isoniazid, pyrazinamide, and rifampicin. When treated, the mortality rate of tuberculosis is less than 5%. The standard treatment of TB involves intensive phase of isoniazid, rifampicin, pyrazinamide, and ethambutol for 2 months. Then the continuation phase of isoniazid and rifampicin for another 4 months. For latent tuberculosis disease, the standard treatment is isoniazid treatment for 6 to 9 months. The second line drugs for treatment of TB includes cycloserine, p-aminosalicylic acid, and fluoroquinolones. The third line includes rifampicin, clarithromycin, linezolid, thioacetazone, and arginine. Sorry if I pronounced that wrong. But although these do help treatments, as with every treatment, as with every medication, there's going to be always side effects to them. So depending on the person's situation, it might vary. But this is what I'm going to be getting into. For starters, for example, the drug pyrazinamide has a bacterial effect, meaning it kills bacteria. It should be watched in patients who are diabetic or have kidney problems, as it increases uric acid levels. This drug can also cause problems with liver and kidney function, and GI upset that is pretty common with this drug. And ethambutol, this drug stops RNA synthesis, but in worst cases can cause vision changes and loss of eyesight and damages to the peripheral nerves and numbness in the extremities. And rifampicin, it stops RNA polymerase, and its side effects are body fluids appearing to be orange. I know nobody would want to think of the thought of having orange blood, but if that occurs, you gotta see your doctor. And another side effect this has is that it influences birth control by making it less effective. So if you're planning on not being pregnant and you're on birth control, I recommend you gotta consult with your doctor before taking this drug and before being on it. And it also causes the skin to get sunburned really easily. You can get your skin sunburned really easily if you take this drug. Okay, another drug is isoniazid. It's thought to grow a bacteria as well, but it decreases the vitamin B6 levels and can cause peripheral neuropathy, and lastly, streptomycin. This is involved in stopping protein synthesis and killing bacteria, but the only downfall it can have is the ringing of the ears, and it can affect your hearing a lot. So those are all I got for now. If you have any side effects, you gotta go see your doctor about that. I recommend it completely. And this is the end of my presentation. We already talked about this. We talked about early detection and treatment. We talked about protective measures such as face masks. We talked about health education and the way of primary prevention. And we talked about territory prevention, rehabilitation, and limitation of disability. These are my references, and in case you're interested, you can go take a look and check for yourself if you're interested in this topic. And yeah, this is pretty much the end of my presentation. I hope you guys learned a lot from this presentation. I did the same subject as someone else in this class. So if you want to have a little bit, if you want additional references, you can check their page, you can check their video. And yeah, that's all. My name is Ugo Njaka. I hope you learned a little bit more from seeing this video. And yeah, this is probably your first time seeing my face in this class. I hope I did a good job, and thank you guys so much for tuning in. All right, bye.